In this video, you're gonna meet Florencia, who we've been treating for chronic low back and hip pain. This is probably the first video that we've documented treating somebody's intercostal nerves, which is when the nerve gets stuck in the belly. So she wasn't able to bend backwards, and we freed up that nerve entrapment in her belly. She was able to get much further back. So I hope you like it.
If I'm sitting, like working for, like an hour or so, when I get up again, that's where I feel it.
How intense is that?
I can find it. Lack of range of motion.
Pressure, pain, pulling, pinching, throbbing.
A little bit of pressure and a little bit of pain, yeah.
How intense is that from 0 to 10?
5.
5 and 10.
So yeah, that sitting to standing is usually the hip flexors are pulling too tight and then it overloads the disc in the low back. So that's why it's just gonna be more of the same with you, because your belly's wrecked, like most people with low back pain. She's had all kinds of stuff. So whatever, it's 19 visits, she's 90% better, her low back pain, which she's had for years. She's got deeper stuff down, but recently I've been focusing a lot on people's intercostal nerves that come around the right inside the abdominal wall. And I felt something in the way from getting deep. And this intercostal nerve that wraps around like this. So I'm gonna treat this nerve, we're gonna pin it down as Casey stretches her abs down. Let's check bending backwards. One pass, recheck.
Yeah.
This is the most fun. You said 5 out of 10 pain in the low back? Bend backwards. 0 to 10.
Oh my god. I just got so much more range of motion.
Isn't that cool? 1 out of 10 pain. One pass. Video's done. So that's what's cool when you have abdominal entrapment. So this can't stabilize or stretch, and it was overloading her low back. So she got way more range just releasing that one spot of the nerve entrapment at rectus abdominis, Casey. And it's gonna unload her low back even more. Moderate to severe. She's got another one right up here. So she's feeling that upper glute symptom that could be a local tissue, cluneal nerve, glute med, glute max, disc referral. I'm thinking it's most likely the disc that's shooting, so I'm just trying to find the tightest, what tissue's pulling the tightest in her belly that we can release that would unload the disc. So this is her lateral femoral cutaneous nerve at iliacus.
Yeah.
Gone.
Thank you so much.
You're welcome. There's a lot of stuff going on with all the nerves in the front of the spine here. Typically when we do abdominal stuff, it's usually deep to the abdominal wall. It's usually in line with the psoas muscle and all the nerves on the front near the psoas. So the femoral nerve is on this side, the obturator nerve is on this side, nerve roots this way. But if you add muscle layers, people also have nerves inside of the abdominal wall right here. These are the intercostals, subcostal nerve, and the iliohypogastric nerve, the anterior branch. You can see now that there's space right here, right where rectus abdominis would be. There's rectus abdominis coming back in play. But rectus abdominis is what connects the abdominal wall, and she had a cutaneous branch of the subcostal nerve right there stuck and glued down. That nerve comes from this nerve that wraps around the abdomen. And then when she stretched back, she got a greater range of motion. But if there's a nerve entrapment there, the entire rectus abdominis and the entire abdominal walls can be compromised, which is why these nerve entrapments are so important to fix. So we've been focusing a lot on the nerves, the intercostal nerves in the abdominal wall. The relief comes immediately when we do.
If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.